This is your first time at the Georgia MedTech Innovation Summit. What are your impressions of the event and the people you've met here so far?
Yeah, it's been a wonderful event so far. I've never been to Georgia before, and I've been candidly really surprised at how comfortable it's felt here, and it's been a lovely country to spend a few days in. The accommodations are wonderful, and it's been a really high quality event from an attendee standpoint. I go to conferences all over the United States and Europe, and there's a very high quality level of CEOs, investors, and other stakeholders at this event, so it's been wonderful.
Speaking of events, I know you also go to Lifeblood's event. They have a couple throughout the year. I understand you collaborate quite closely with Giovanni, who runs Lifeblood. How do partnerships between legal experts and ecosystem builders help early stage medtech companies succeed, in your opinion?
Yeah, I appreciate the question. I think it really comes down to what service providers in the medtech industry are looking to accomplish. So the best service providers, it's about helping the company actually accomplish its business objectives, and whatever those objectives are, raising capital, getting the right clinical data, selling the company, whatever those objectives are. As a service provider, I want to be as helpful to my clients as possible. And as a legal firm, I can only do so much of that with my skills and my backing. So I truly think that the best service providers are those that have relationships, strong relationships with other areas of expertise that, again, can help their clients. So, for example, with Lifeblood, the executive recruitment firm in the medtech space, it's always been just a really natural fit where many companies need help setting up an entity in the United States, particularly companies that originate outside the United States, and I help them with that. But then one of the first things that they do is hire their US team. And so working with Lifeblood and sort of being integrated in, okay, we're going to form your entity, and then Lifeblood's going to come in and sort of place all the individuals with that entity, has been super synergistic. So it's been a wonderful partnership, and we anticipate it continuing for years to come.
Great. And from a legal and regulatory perspective, what trends are you seeing among early stage medtech companies, especially those preparing for funding or clinical milestones?
Yeah, so I think the biggest trend that I've seen in the last several years, and I've been working almost exclusively in the medtech space for over 15 years now, is of course the passing of the MDR regulations in Europe about 4 years ago now. What that has caused is many European-based and ex-US-based medtech companies that were historically seeking CE mark first, they're coming to the United States earlier in their histories. So medtech companies have always come to the United States, either seeking funding for larger rounds or always to take advantage of the commercial market. These days, though, we're seeing medtech companies come to the United States more as startup companies than in decades past. And so that brings a whole host of different legal needs that an early stage company faces that a later stage company will historically have already taken care of, and many new hiring needs for those companies as well. So that's a big trend. It's affecting my business and Lifeblood's business.